just pushing the boundaries, but are actively reshaping the sector that we're in. Today, we'll dive into the future of healthcare, where AI, XR, IoT are not just buzzwords. These are powerful drivers of real outcomes. They're transforming patient care, drug discovery, medical interventions, and devices. You'll witness firsthand how collaboration between academia, industry, and startups is shaping the future of healthcare and health edtech. While innovative tools such as Spec Health LXP are revolutionizing the learning experiences and the organizational performances, we'll also explore the exciting realm of spatial computing, immersing ourselves into how this technology is redefining healthcare visualization as well as interaction. I encourage all of you to be curious, ask questions, think about how these innovations can apply in your work to gain a competitive edge, to understand industry trends and to stay ahead of them, and to develop cutting-edge solutions. Before we dive in, there's a QR code on all of your badges that is scannable, and you can get access to our company's website as well as today's agenda. We've also shared a feedback form in all of the booklets, and you can fill these to understand more about the technology and engage with industry experts after each of these sessions. To introduce the agenda of the day, we have a session on the future of health by Ms. Hani Jand. Then we have simulation in health sector by Dr. Vikas LK. Then we have a panel discussion on advancing health and health edtech moderated by Mr. Navratan Kataria and Dr. Ravi Shankar Swamy and Mr. Hari Srinivasan as the panelists. We then have an exciting showcase of simulator in action by Ms. Varsha, AI in action by Ms. Bhuvana Kumar, as well as XR in action by Mr. Pramod and Sughosh. Finally, we have a session on AVGC XR Policy 3.0 by Mr. R.K. Chand. Now let's kick things off with our first session, the future of health, where we'll explore the role of generative AI, XR, and IoT in learning and development within the healthcare and the pharmaceutical industries to understand the revolutionary changes that these technologies are bringing to the table. It's my great pleasure to introduce our first speaker, Ms. Hani Jand, who brings in more than 2 decades of experience as a lead learning and development for a global pharmaceutical company in India. She has established L&D functions in some companies, and she's passionate about simplifying and changing the way that we discover complex knowledge and the information through enhanced learning experience and digitization. Ms. Hani brings a wealth of knowledge from the pharmaceutical industry and is at the forefront of integrating emerging technologies because she wants to drive impactful change. Please join me in welcoming her as she takes us through this insightful session. Thank you so much for a warm welcome, and thank you for being here. So good evening, ladies and gentlemen. In my 2 decades of learning and
I hope I'm audible. Yeah? Yeah. So, I have worked with insurance and pharma and other industries as well. So, I have witnessed many shifts during that period of 2 decades in L&D, but nothing compares to the disruption that we are facing today because of the technology. So, I'll be focusing on some of the areas. How we will see that how future of L&D in health and pharma is impacting and shaped by the emerging technologies, generative AI, extended reality, 5G, and Internet of Things. These are some of the topics that I'll be combining with how it has impacted L&D in pharma. These technologies are not just influencing how we learn; they are transforming the entire learning ecosystem, driving the unprecedented advancements in training and development and knowledge application. Today, I want to focus on 5 key areas in L&D. One is that I said, and let's go ahead and see those areas. One is the artificial intelligence in personal learning. So if you see the healthcare, how the artificial intelligence has played a role in learning, the biggest issue that we face is identifying the learning gap or the training needs. That who needs what, and it is practically very much impossible to understand, if we have an employee base of 2,000 or 10,000 around, who needs what is very difficult, and that is where the AI plays a role in terms of understanding and customizing those training needs for individuals. It is not only helping us in customizing the training needs for the beginners, but also how healthcare professionals can keep a pace on learning needs in the future basis if there is any learning gap. So that's one thing which is impacted by the AI. So it makes the people like, L&D people like my job easy, like who needs what, and fixing those solutions for them. It also, so this is one of the places where AI plays a role in the healthcare professionals is understanding their learning needs. And it customizes to, what they actually personally need those kind of knowledge and interventions. Another is how the XR is helping us in immersive trainings. So imagine somebody who is wanting to do a surgery and who is learning the knowledge by theoretical reading the things. This technology helps us, this immersive technology and training helps the students or the learning professionals by doing those things in a virtual reality or in a augmented reality. So this also helps us in terms of making learning more impactful. And at the same time, it is a lesser risky one. You can learn those things by actually doing it without a patient in front of you. So that's one thing that actually the extended reality helps us in immersive trainings. And this also bridges the gap between the practical and the knowledge that the person reads. It also helps in drug discovery, So when we integrate those, not only drug discovery, but also learning about the drug discovery. So it enhances the training of complex molecules in pharmaceutical processes, because when we talk about drug discovery, the knowledge is really complex, and who needs what again is a concern. How can they leverage those informations? It is with the help of AI that they can only plug in and pull out those details that they need. It also reduces the market time to market, the launch for the market from the discovery to the launch. So these are some of the places where AI helps in translating those complex information into, as per the need of the research professionals, and thereby making it easy rather than, searching so much of information at a time. So one is on research. So it also helps in visualizing the pharmaceutical trainings. There are complex molecules, how those complex molecules are structured, how they interact. They can bring out those simulations and understand that how these complex molecules look like and what will happen when these complex molecules will interact. So they can, the research professionals can understand this thing better with the help of the immersive technologies, that how it will appear and how it will act on our bodies. IoT in real-time learning, again, there are many data that club in and they come on a platform where we can understand what is the need of a professional. So a person who wants to learn something, they can just understand by, people can understand by just, for example, in a medical field, there are times when they have to work closely with the healthcare professional to learn the things, see the patient real time and then learn. Maybe that patient, after 5 years, they will see the stages of the patient and then learn. But this IoT helps them to learn. The real-time data gets collected and then they analyze those data and then they learn those things faster and easier without spending those kind of times physically there with the healthcare professionals. So this is one thing that actually helps us, and IoT is helping in many other ways, but this is just an example how it is impacting in learning and development. That is what I am emphasizing on. This also helps in the supply chain disruption, because if you see the e-commerce has done it very well, it is also entering the pharmaceutical space, that how it is, helping us to understand that there are stockouts or what is the inventory, how it is integrating the supply chain and the market requirements. With the help of this data, we can understand that before the stockouts have happened. So this is how, the IoT helps in understanding us, like what are the gaps, what we can do in supply chain. There are many data from the machine that can help us in smart manufacturing processes also, when IoT is integrated with other devices and manufacturing equipments and supply chain, etc. So I will also say that, see, you tell me and I know, and you teach me, I learn, but you involve me, I am actually able to do the things. So this is what the immersive technology has brought in pharma. There are many, since it is highly regulated, there are many things, in manufacturing, there are so many SOPs. Once they are, if we combine this immersive technologies with those processes, I think the trainees understand better, So for example, if a person joins an industry, in manufacturing in pharma, a person who is ready after 6 months, the person is not immediately ready to perform or, not ready to deliver. So it takes 6 months of time for a person to undergo those training and development processes. And, we are sure, because it's highly regulated, at times, if it is US based, if it is FDA regulated, so we have to take care of those regulations as well. And GMP and GXP is a very vast topic, right? So how do you make that person ready in 6 months is also not that sure. But this immersive technologies, IoT, AI helps us to bring learning and development, makes the learning and development more effective, and the readiness of the person to perform better. So these are some of the things that I've explained, mostly from the point of view of training and development. But I think this has a vast use, whether it is manufacturing or whether it is supply chain in pharmaceuticals or in healthcare. So, but this is actually my topic. I take care of learning and development. So this is something that I could throw some light on, how I have implemented in my organization the XR project, wherein we have converted some of the SOPs into the virtual reality. With the help of those Oculus headsets, the trainees get the training on those, and it is very easy. They are also excited. But only thing is, let's make it popular, imbibe these cutting edge technologies into our workplace so that it is more accessible. Currently, the accessibility is a concern because the cost is huge. So I have to always convince my leadership, how I can say that the cost of one human manpower is not equal to one cost of training, right? Once it is popularized, once the cost also comes down, the cost will only come down when we all will use it. Yes, so let's start imbibing these new technologies, so that we are ready for the future. We are not only managing the present better, but we are ready for the future. So thank you so much, and thank you. Thanks a lot.
Thank you, Ms. Honey, for such an impactful session. Your discussion on the future of health has definitely opened up my eyes, so I'm sure like everybody else might also be feeling inspired about the new possibilities and the innovations that will drive our industry forward. So let's move on. We'll now delve into the simulation in health sector. From enhancing clinical skills to improving patient education and product training, simulation is quickly becoming an indispensable tool in our sector, in the health sector. This session will reveal the profound impact that simulation technology can have on both the patient experiences as well as the effectiveness of medical products. I am very honored to have with us Dr. Vikas LK here, a simulation strategist, a lead physician, as well as the founder of Total Care Clinic. He has had an eclectic career. He's been a part of clinical teams, simulation education, as well as pre-sales at GE Healthcare Institute. He has served as a deputy medical director at Saga Hospitals and has been part of the administration at various hospital chains such as Cloud9 and Aster India. He's also been a part of educational institutions such as Sri Ramachandra Institute of Higher Education and Research. He's currently the lead physician and founder at Total Care Clinic, which is based in Bangalore. He is passionate about using technology to just make things easier. His insights will undoubtedly provide us a deeper understanding of simulation technology and its benefits and capabilities. We welcome you, sir.
Thank you all so much, everyone, for braving the rains today and making it out here. Always wonderful to speak to a crowd which is made up of so many aspects, so many areas of the health sector. So we use the term health sector to be as broad as possible. And honestly, I feel a kinship with every one of you, because at some point or the other in my eclectic career, so I have been on all sides of the table, and speaking of table, when it comes to benches, I was always backbencher, so last row will always be my best friends. Okay, and I keep joking about this, before we get into the topic itself. So we've always had the concept of front benchers, back benchers and everything. So show of hands, whoever considers yourself a backbencher. Quite a few. That's why we are all here, right? So we do things differently when we're in the backbench. But the greatest thing about simulation learning is that paradigm of front bencher, backbencher is gone. All of us get a ringside seat. So that's the greatness of simulator education, and I'm speaking a little bit from personal experience as well. So the last 5 years I was with GE Healthcare. Now I have my own practice. Again, my practice is an experiment, up and coming experiment. We'll discuss about that. But my time with GE Healthcare, which is an innovative organization, at the same time is very focused on outcomes. And I'm very sure, people from, let's say, competitor companies would also agree. There is a lot of focus and there is a lot of rigor on execution as far as outcomes go. So in that kind of environment also, we saw how great simulation is when it comes to learning outcomes. And it was, for someone like me, the job was very easy, because when we look at medical professionals, when we look at participants sitting learning from a simulator, we see what might have taken 6 hours of study from a textbook, what might have taken a 2-hour lecture. It's happening there in 5 minutes, in 7 minutes, And the other thing is, reading from a book or learning from a lecturer sometimes is a very individual experience, How we connect with the professor, how we connect with the teacher, that matters to us. How the words, make sense to us out of the pages of a book, that is a very personal experience, and that has its place. But when it comes to simulation learning, we see, of course, the kinesthetic learning aspect is there. So, like, ma'am, you mentioned this in a way that if you involve me, I never forget. So that advantage is there in simulation learning. But at the same time, we see that there is a remarkable standardization. Okay. So Richard Feynman, the scientist, he said this, that all of our brains work differently. If somehow we had a technology which could scan each person's mind right now, it would look very different. My mind might be throwing up numbers and square root signs and equations and all that. Somebody's would be throwing up colors and things like that. Some people think in terms of music. Some people think in terms of movement. All of us are different. We think differently, we learn differently. But when it comes to simulation, in spite of all these individual differences, we find a remarkable standardization. So that is why I said what I said, that we're not front benchers or back benchers, we get a ringside seat when it comes to simulation learning. Okay, so with that, we'll move into the topic. Sorry, I think I spoke too long. The laptop has locked up. Can someone help out? Yeah, it needs a thumbprint. Okay, so I just wanted to get a quick poll. Show of hands, how many in the group have worked with simulators in some capacity? Yes. Okay. How many of you have an interest in knowing what simulation is exactly? Okay, great. And how many of you are actually having a project coming up in the next 3 months which involves some use of simulation? Okay, great. If we were to do this conference a year from now, we would see a lot more hands going up on this third category. Okay, and the reason we're saying that, and I have a slide for this, is also simulation learning is going to undergo a significant explosion. Okay, and who's going to make this explosion happen? It's all of us. And in fact, even outside, we were having some interesting conversations before this event started. So one thing that we realize is that when all of us come together, we can actually move ahead faster in this field. So, you know, each area, for example, hospitals, healthcare providers, training institutes, pharma, biotech, everyone has a specific strength that we bring to the table. Okay, and what has been lacking so far, maybe why we've not seen the kind of explosion that we see. One is we've had maturation in technology. Second is we're having more of these bridge characters, you know, people like me coming up who are able to think clinically, who are able to think technologically, and who are able to bridge these worlds. So there are more of these type of people coming up, and this is closing the gap. You know, we're no longer working in silos. So we're all here together, and you know, this represents one ecosystem. So the broader message that I want to pass on through this discussion is that we are a single ecosystem, and you know, the moment we start sharing our strengths, our resources with each other, we actually move quicker on this journey. Okay, so ultimately, what is it all about? You know, we want to transform what it is for the patient. The patient is at the center of everything that we do. Okay? Regardless of learning, or you know, regardless of having better outcomes in training and everything, all that is fine, and we are going to come to that. But the point is that we want the outcomes to be better for our patients. We want it to benefit society at large, ultimately. And how do we do this? Primarily, we are looking at reducing errors, and we are also looking at more confidence when it comes to utilizing skill. Okay, so let's see more into this. Now I want to paint a picture for all of you. All right. So just imagine you're with your friend. You have a hospital appointment. Okay, and you go over. You enter the hospital. You're going to have some tests done, and you have someone greet you over there. You know, a nice hi, hello. They already know who you are. They know you by name. They know your friend by name. And they say, you know, why don't you come to this kiosk and we'll guide you through the flow for today. You're there for a master health checkup. You're going to get some blood tests. You're going to get some ultrasounds. You stand at the kiosk. The kiosk starts talking to you. The kiosk knows your name. The kiosk tells you exactly what your workflow is going to be. So you're going to be on ground floor. You're going to go for an X-ray first. Then you're going to go for a TMT. You're going to meet so-and-so technician. All of this information seamlessly, your escort comes back and says, come along with me, I'll take you for X-ray. One by one, you go to each station. You go for an X-ray, you go for a TMT, you go for an echo, you go for an ultrasound after that. Everything seamless. I won't say there's no waiting time. There is waiting time, but that is filled up with information bits. Before your ultrasound, your escort gives you goggles. You wear those goggles just like this, and you're able to see exactly how the ultrasound is going to be performed, what the procedure is, what the report is going to tell you, who your doctor is going to be, and it even tells you how you can wipe the gel off after the ultrasound. All right? So just on a lighter note. And then you come away from there, you meet the doctor at the end with all your reports. Reports are ready, the data is with you, the data is with the doctor. You have a conversation, no laptop screen in between. It's a human-to-human connection there. And conversation is captured, notes are made ready, notes are emailed to everyone. If you wanted to go to your husband or wife, it goes. If you wanted to go to your parents or your kids, it goes. Payments all happen automatically, everything done. You're in and out in exactly the time what was promised. And you can meet your friends for lunch. How does this sound? Good. That's a good point. We should think of a restaurant in the hospital itself. Okay. So the reason I painted this picture is it's not too far off in the future. The technology that can make this experience seamless is already existing. See, one thing that I didn't mention in this, we just spoke about the patient experience. But just imagine if you get a doctor who's doing the ultrasound, maybe he's not the most experienced doctor in the world. Maybe he's not the senior or the superstar doctor you thought you would meet. He's a young person, but they hold the probe confidently, they place it, they make those fine twists and turns, they get an image on screen which is worth going into the Lancet, for example, and they're able to do all of that in double quick time. There's minimum pain and you can literally see the expertise in them. Okay? And how does this happen? How does this level of expertise come? Of course, it comes through training. But what if that training were done in a safe environment? What if that training were to happen in a way where the participant can make 100 mistakes and not worry about it? Okay? So when we were coming up, we were always worried about making mistakes, not only in the profession, in life also. So a lot of times we may not attempt doing something because we're worried about what if it goes wrong. Okay? But the greatness of simulation education is that it allows you to make mistakes in a safe environment. You gain confidence by making mistakes. And then you slowly get better and better and better. And practice makes perfect. We all know that. So how do we make this happen? How do we make this possible? And how specifically, what is the role of simulation in this? Okay, so let's look at this. So by the end of this session, and we'll run through quick, is how does simulation apply to me? See, I could be in any part of the industry. I might be a clinician, I might be someone from a medtech company, I could be in a product development function, I could be in a sales function, anything. So how does it apply to me? And as we said at the beginning, so one is, of course, you can think on your own about this, but at the same time, we will present the possibilities that exist right now, and it's extremely exciting. So I'm known as a technology nut in my circles. So I love when technology makes things easier. So we're going to see how it makes it easier as well. And why does it matter? That is extremely important. Why does it matter, and why does it matter now? And of course, okay, simulation is a nice word. We still haven't defined boundaries around it. But given that we understand the boundaries, how do we use it? Okay. So, getting into this, we need to understand the world that we are stepping into. Okay. So, if you look at just pure demographic factors, how is the population changing, and especially in India, how is it changing? So, whoever is entering into healthcare now, let's say they're going into the first year of medical, or let's say they're going in as an allied health professional, for example. They are going to be the doctors, the clinicians, the technicians of tomorrow. Okay, the age cohort is somewhere around 25 to 28 years when they're ready to come into the mainstream. Now, the important thing is that this healthcare graduate pool is born into technology. They did not have to learn technology the way we had to learn. They were born into it. It comes natural to them. So again, a show of hands. How many of you have little kids in the family? And how many of these little kids are extremely comfortable with gadgets? Say, all of them. So you've seen they swipe and they do it better than us. And they receive no training. Right? So it's just intuitive for them. Of course, the point that we're going to make is even the technology was built intuitively. That's there. So, it's like how Steve Jobs said, if a 3-year-old can use it, anybody can use it. And sometimes I think the 3-year-olds are actually pretty smart these days. Okay? But the point is that these technologies were built intuitively. They were built to be easy to use. And this is the generation. So this is a generation that expects ease by default when they come in. Okay, so the old-fashioned methods are slowly going to be not as acceptable as what they were. Ease is going to be taken as a given, that learning has to be easy. Learning has to be, it should not cross a certain threshold of difficulty. Of course, medical learning is difficult. Medical education is difficult. Making a simulator is difficult. We know this. But if we can make it just that little bit easier, I don't say easy, I say easier. If we can make it a bit easier, okay? So just going by demography, by the way, India is going to have a huge demographic dividend, they call it, a demographic advantage, is that our growth rates in these age groups are not really slowing down compared to other nations. So we're actually going to have more graduates, we're going to have more people in this age group with very similar expectations. So it's up to us to gear up really. Now, for those who are in a sales or a marketing function, I think this is not a very new term. Demographic is one thing, but psychographics is another. So basically getting into the mind of the consumer. Okay, I take liberty to speak about this because I've also studied a little bit about it. Okay, but the point is, when we look at those who are coming in to the healthcare roles right now, okay, it could be as a technician, a future doctor, or a nurse even, okay, there is a difference between, say, our generation and those who are coming into the talent pool now, who are even those who are graduating right now and who would be working, say, from this September onwards. Okay, belief systems, values are all a little different. Okay, what is their equation with technology? Extremely interesting. They're much more comfortable with technology. We spoke about this, but to the extent that even this was an interesting experiment even we had done at our workplace, and there are other surveys that second this. A person from this age group is more comfortable sharing sensitive data, confidential data with a bot than with their friend. Would you believe that? They trust the technology more. They're open to technology more. Okay, and if you Google it up, there are some very interesting conversations which happen between a chatbot and a person who's likely to be a healthcare professional. Sometimes the whole conversation gets an emotional nuance to it. It's just like talking to a friend. So on the one hand, these technologies are becoming extremely good. They're becoming more like human. Okay, but it tells us something very revealing, that the comfort level that the demographic, the psychographic has with technology is something we cannot underestimate. Okay, we may have a non-technical or a non-technological solution for the same problem. Okay, but I would bet that there is an edge if an advanced technology is involved. It becomes more trustworthy for this psychographic. It becomes more acceptable to them. Okay, and this is, it's a postulate, it's a hypothesis, and people can disagree at this point, but this is likely to be what becomes a demand driver into the future. Okay, what the market is going to look like 5 years from now, 10 years from now is anyone's guess, but the way it's moving, even 2 years from now, who knows? Okay, so we've understood where we stand. We believe that we stand at a cusp. Okay, when we look back, we say the last 6 months or the last 1 year versus the next 1 year is going to look completely different. So why is it that we are stressing upon AI, XR, simulation, and all of these technologies? And what is it that we need to take away from all of this? See, the point is, tomorrow's everybody, tomorrow's customer, tomorrow's trainee, tomorrow's KOL also, all of them, we need to understand them better. We need to know what we are, I won't call it up against, but what is the situation going to look like? We need to understand the mega trends. Okay, so we need to cater to their needs better. And the third point, the guidance, the mentorship. See, it's up to us. And an interesting statistic when it comes to the particular demographic and psychographic that we speak about is, even though we are going to have the largest cohort of healthcare professionals, we are going to have the largest number of graduates as per UNESCO. By 2025, we will have more number of graduates graduating out than we have ever had in history. Okay, some estimates put it as by 2050, we'll have a process called academic inflation, where everybody has a degree and therefore everyone is equal. All right. So the point is, what makes the difference then? Guidance, mentorship, and that is something that simulation learning can give. Okay, like I said, it's a ringside view. Just imagine you have 20 professionals all learning from an expert on a machine. The machine does not judge. And it's a low risk environment, it's a safe environment. And the learners are all on an equal platform. They're all learning equally well. And of course, the mentorship is important because it goes beyond academics, it goes beyond learning, it also goes into life skills. Okay? And we can all agree that that's something that all of us benefit from. All right? So it really is up to us. Now is the time we understand better, we cater to their needs better, we guide and mentor this demographic, this psychographic better. And of course, all of us know, whatever it is, whether it comes to academics, whether it comes to sales, whether it comes to business development, marketing, whatever it is, meaningful relationships ultimately matter the most. How many agree with this? Okay. And simulation is one way we can build a meaningful experience and we can start building meaningful relationships, okay, with this demographic of tomorrow. So let me just quickly go through this. See what's changed. Simulation has been around. We know that pilots have trained on simulators forever, and simulation in healthcare is not new, but it is going to explode. It is going to have a very different flavor. Why is that? Number one is, of course, the technology capability. What the technology can do is very different today than what it was even 18 months ago. Okay, and we're going to see more about this in the coming talks. And the interesting thing in healthcare is the customer, the definition of customer and the definition of beneficiary is not always the same. For us, the ultimate end beneficiary is the patient. Would you agree with this? Yes. The customer may be anyone else. Okay? But we are likely to start seeing similar demands from both of these segments. Whether it's the beneficiary, whether it's the customer, power is going into the patient's hands. Patients are becoming more aware. Patients are having more questions. They want to understand better. They want better outcomes. They don't want to take risks, even if it's a 2%, 2.5%. They're not going to listen to us. So it becomes imperative to understand these dynamics. Okay? And of course, the cost factor, as Honey ma'am said, that eventually the costs always come down. That's another factor. Okay, so just a quick look at this. All I would request here is have a look at these boxes and look at where you fit. Because as I said in the beginning, we don't belong to boxes anymore. We are all one ecosystem. Okay. So I'll spend a few minutes speaking about how simulation applies in education, because that's the biggest need and that is also the easiest to convey in this format. Okay, so for example, when it comes to say for example ultrasound training, I'll just take an example. Okay, so we've all looked at ultrasound reports. There's a lot of variability. There is inter-observer variability and there is inter-operator variability, all of this. Now what simulation training does here is, let's say we have 20 of us in a classroom. We're all learning from the same instructor. We're all learning on the same simulator. All 20 are very likely to come to a similar level of proficiency when it comes to training. Okay? And training can happen on the basis of standard guidelines. So the standardization factor can be built in. Okay, and all of this can be pre-programmed. It doesn't have to be just driven by the instructor. It can be pre-programmed. One of the big advantages in simulation is self-learning mode. So learners can learn by themselves also. So the institute, for example, which is responsible, is not necessarily dependent on a superstar faculty to deliver the training. You can always have sessions where the learners are self-learning. Okay, so there is a hands-on, hands-off component to this. Now, that's one area, one big pillar. Okay, and there's more to talk about, but time factor, so I'll cut it short. When it comes to our end beneficiary, the patient, so there are a lot of use cases when it comes to educating a patient. How many of you have seen a leaflet inside the medications? Generally, when we buy paracetamol or anything, you've seen. Okay, you've seen the leaflet. How many of you have read the leaflet? Okay, good. So the point is, the leaflet is important. You would understand. You would agree with that. Okay, and we want the consumer, the beneficiary, the patient to know that information. Now, just imagine if the leaflet is not a leaflet. Just imagine that it's a virtual video. You can watch it on 3D goggles, or it comes onto your WhatsApp. You look at it. Much more engaging that way. Dosage instruction is as per the doctor's advice. And how many of you have questions on side effects when it comes to medications? Generally, before you have a medication, how many of you, okay, I should rephrase this question. How many of you worry about side effects? Almost everyone, right? How many of you experience side effects? Smaller number, right? So the fear of side effects is a bigger disease than the side effects itself. Okay, so what simulation can do here, or what these technologies can do here, is really to assuage these fears. Okay, it's all based on data, it's all based on fact. Not saying that medications don't have side effects, but then the leaflet has all the information. Simulation gives a way to present the information in a much more digestible, much more palatable way. Okay, and likewise, we all have teams that we need to train. We all have teams. We give them products and we say, hit the ground running. We want to start seeing numbers straight away. And training is an intensive process, ma'am would agree. So the organization of it, have your resources available, people have to be trained, etc. But if you were to deliver the same thing through, say, an avatar, let's say you have the company CEO's avatar virtually there. Think of how many corners of the organization you could touch in just 10 minutes. You could literally train everybody in the organization using one AI bot. Okay? And availability is not an issue. Time zones are not an issue. So there are interesting use cases for this technology. So that's why we say we're not talking about just process improvement here. We are talking about next level thinking. We're talking about a quantum leap. We're talking about redefining the paradigm entirely. Okay? If it is a bit difficult to understand, I'm with you. It takes some time because it's a next orbit of thinking. Okay? Yes, please.
Students giving the session, right? Everybody has come to this particular level, but it's not guaranteeing that everybody has really understood the things, right? So is there any way, I'm saying, as part of simulation study as well, or training them, I'm saying it can be cut across all the industries as well, where a kind of you'll be able to, I don't know what is in the brain sits there, which can be can be fed, as you talk about IoT, can be tapped back and feed it to the simulation thing, saying that yes, I'm saying it's kind of a more of a intuitive and very interactive simulation experience for the human, so that even simulation understands that whether the person who is learning has understood properly or not, and kind of train them again.
Okay.
I don't know whether I'm able to.
Thank you. Thank you so much for that. So if I can rephrase what you asked, number one, how do we know that everyone trained through simulation is of an equal standard? And number two, how do we know that they are of a good enough standard? Right? This is, in short, this is your question.
In addition to it, just like basically what you're saying can be added, like in terms of a human, basically human interactive way, or that is like exactly, so that the conversation is still by a bot is happening, but it's still feeling like the human touch is there. I guess that is the question in terms of, and this is the addition that I want to add to it.
Okay. So a very interesting addition. So can we have a human component to the technology? So I can answer this, from my past 5 years of experience, some of the work that we did when I was part of GE. So what we looked at is exactly the same question. Number one is, how do we ensure that everyone is of the same standard? Okay. So in simulation, it is important to understand. I think you bring out a very powerful point here. So we are talking about technology today, but equally important in simulation learning is methodology. Okay. Methodology really matters. And in fact, that is why we need professionals from diverse fields to be able to put this in place. So we need proper methodology, we need proper technology as well. We need the realism, but at the same time, we need to understand how do we evaluate those participants. So there are two ways that we achieve this generally. One is a technological solution. Through the technology itself, the machine records, for example, in ultrasound simulation, the machine records your hand movements, it records how you've formed the image, and it has a template. So it knows what's a good image. Your image is compared to the reference image, and then there's a deviation score given. Okay. So if your deviation is anything 5% or less, that means you're more or less you've got it. So you have made the right hand movements, you have got the right image, everything. If your deviation score is more, it encourages you, try again, try again, try again, that way. And until every participant reaches the deviation score of 5% or less, the thing doesn't turn off. It stays on. So you have to keep practicing till you get it right. That's the technological aspect. Now I'll bring in the human aspect to this. So how we did it is we formed a WhatsApp group. We put all the participants in there along with the professor, the mentor. And they used to keep sharing their images on that group. So now there is a peer angle to it. So the fellow participants are looking at how the other is producing their images, and the professor would also give tips. Okay, you should have slightly held it a bit lower, a bit higher, twist it a little to the right, twist it a little counterclockwise, that way. So that fine tuning, the human touch comes there. Okay, and these groups, I tell you, you mentioned a point about retentivity as well. This is something I can speak about right now. So when we attend a conference, how many days would we remember what we hear? I'll give you a range, 1 week versus 1 month. Which is more likely? 1 week. Okay, if I were to say 1 day versus 1 week, which is more likely? 1 day, right? But I tell you, the participants in these workshops, you won't believe 9 months later, they still remembered what they experienced in that workshop. 9 months later. And the science tells us, yes, the 12-month retentivity is really good and everything. It's fine as data, but when we saw it live, it was amazing. You say, wow, these people, they're sharing images from their actual ultrasound machines. And we can see they've imbibed everything that they had learned in the session. So in terms of training transfer, there are protocols to assess how much of the knowledge has actually been transferred to the participant. Standard methodologies are there. But this itself told us everything that we needed to know. That they were able to produce images, and they were also able to evaluate a peer's image, saying, Acha, you should have held the probe a little this way, you should have zoomed in a little, you should have increased the contrast a little. Very specific feedback could be given by the participants themselves. So we say that maybe they've not reached the level of the teacher, but they're close there. And the teacher says, no, they're as good as me. They can do whatever scans I do, they can do it. So that's the power. Yes, please.
So can we take questions in the end, please? We have less time. Will okay, please.
Thank you so much. In the interest of time, just keep it quick. So this is Dr. Rajesh. That's wonderful. So a couple of suggestions, or the recommendation probably I would like to give it. One is that with reference to the evaluation of the candidates, adding the human touch. I believe the virtual headsets allow the multiple users to be logged in at the same time. And even the tutor can log in into the virtual world using the virtual headset. And it would be more precise. I mean, I understand the WhatsApp group, but the extension of that WhatsApp group can be and virtually involving the human factor. That's one. And second thing is, with reference to the patient, the movements of all of that, I believe that was performed on a dummy. Right. So, yeah. So I think while the objective of using these technologies to reduce the time taken to train on the real patients and also to minimize the medical errors is achieved, probably we can have a bar set that may be 90 to 95% of the accuracy. You can get it on a dummy, while the final certification can happen on the real patient before he can actually perform the procedure. That's it. Thank you.
Sure. That's an interesting suggestion. And in fact, there are some institutions which follow exactly this procedure. So the simulation is meant to be a low risk environment where you practice through repetition. But ultimately, the final evaluation will always happen once you're deemed ready to go onto a patient. Then you have one more round of a final evaluation and then you're certified. So this comes in when there are CME points involved, when certification is involved, that is more serious. So, but having said that, in defense of simulation itself, we do have programs where the professional bodies, they recognize passing on that simulator as good enough. So they award points, they award a certificate accordingly, and they say if you have gone through this curriculum, and it's not the manufacturer who deems it, it's the professional bodies, like ACOG, for example, or AHA, for example. So they say, okay, if you have been through this course, good enough for us. You can do it on a patient. That way. Okay. Sure.
When preparing this kind of training sessions, or the way you are trying to train the healthcare professionals and allied services, is there any regulatory or guidelines, like at what level? And suppose you are training different level of different layers of professionals, right? So at what level and what kind of informations, and you should or you should not, or maybe incorporated. Is there any guidelines so far in India as of now?
Okay, so I can answer this question in two ways. Number one, are there any guidelines which regulate simulation learning itself? Answer is, there are no additional guidelines. So the same guidelines to apply to medical colleges, to training institutes, it's the same guidelines which apply. There is nothing additional when you bring in a simulator component to it. At the same time, you do have to abide by the regulations that you would abide by when you're going to do procedures on patients or when you're going to scan patients. Now, for example, one of the things that we had to do, we had an exercise where we were bringing in ultrasound simulation for first trimester scanning. And we did have to get a clearance from the PCPNDT. And the PCPNDT had to satisfy themselves that the simulator does not in any way teach you how to determine the sex. Once they were satisfied, it was fine. So yes, we have to go, and occasionally we had to also go through an education board. For example, if a medical college wants to have a simulator system to train their undergraduates, so the education board would actually look at it, look at the contents and everything, and then would have their own questions. Very similar, what is the competency level that the student can achieve, etc. So we would have enough material, enough data, and now we have enough experience as well to back up all of this. All right. So,
So the government of India now, in fact the Ministry of Health, requires every medical college to have simulators in training. And the reason being that, gone are the days when we had so many cadavers available for dissections and patients available freely who would allow us to poke and, keep on examining them for 2 hours before a teacher came. So those days are over. So therefore it's very, very essential. And like what he said, for examination and determining the competency level of students, there are different levels of questionnaires, cases are prepared, and these are all programmed into the simulators. And it is the medical teachers, doctors, professors who set up these question papers and do the evaluation before they can touch their first patient. And then they go through certain training on patients before you actually go and get certified.
See, recently one of our relative had to gone through a TAVI operations in his heart, right? So, though it's very critical, and and we want to understand, because it's not very common and it's very expensive operation. So I accompanied my relatives, and I insisted that no, we want to understand first how it is going to be and how we are going to place the valve to negate the calcification what has happened. So my question was related to that, like the government of India has did some compulsory things which needs to be there. Like, is there any kind of that compulsion from the healthcare industry? Like, suppose as a patient I have my rights to know, like before I'm going through to such kind of very very like expensive, and it's a very critical operations, right? I had to go through that. It's my demand. I need to know. I need to understand things more thoroughly. Like, that's what probably as.
If you go to any hospital which has undergone accreditation either by NABH or JCI,
Yes.
you will go the board saying that these are your rights. And one of your rights is to know the details of your treatment, the costs that it entails, the complications that it entails, and also the problems that you are likely to face if you don't undergo the procedure, and the alternatives to that procedure. That is your right to know. And everybody is supposed to explain it to you.
No, I wanted to, of course I do understand, but I was emphasizing on the simulation where it can add lot of values and give lot of insights the way
So
that
the
operation has
preliminary
happened.
training, so let's say TAVI procedure, if you have a simulator on which the cardiologist can learn the TAVI procedures, we can have a thing saying that, okay, the cardiologist has done 50 procedures, this is his success rate, and then he's allowed to do. Today, no, so today you don't have that level of simulators, and not only in India, globally you don't have that specific procedure-based simulators. You have just started having interventional radiology and vascular radiology and stuff like that. So we will reach that point, but till then, I think we have to understand,
thank you so much, ma'am. And specific to TAVI, I agree with ma'am, yes. We in fact were involved in a project on TAVI simulation. Long way to go, but we are getting there faster than before. Yes. All right. So with that, parting thought is, if a picture speaks 1,000 words, getting involved physically is worth 1,000,000. Thank you so much.
including leading technology transfers. He has worked for more than 20 years in clean tech, including solar PV and wind, IT, innovation, and startups, and has been in corporate management since the last 11 years. A very warm welcome to you, sir. Sorry, sir. Okay. We also have our distinguished panelists, Dr. Ravi Shankar Swamy, a neonatalist turned innovator in simulation technology and the co-founder and director at Reprosci. He is also a part of the Royal College of Pediatrics and Child Health in the UK, which showcases his dedication to our professional excellence and lifelong learning. Currently, he is the consultant pediatrician and neonatologist at CARES Women and Children's Clinic and Manipal Hospital in Bangalore. He is passionate about teaching and is a pioneer in using digital practices in his professional practice, such as using the Bailey 3. We also welcome Mr. Hari Srinivasan, the Chief Executive Officer of Garbhagudi Institute of Reproductive Health and Research. He is an engineer by qualification, but an entrepreneur by passion. He brings with him a unique mix of expertise in technology, management, marketing, healthcare, and entrepreneurship. He completed his engineering in medical electronics and has been an IT professional for about 25 years, during which he has worked in large MNCs, mid-sized companies, as well as the founding team of multiple tech startups. Finally, we have Ms. Vasha, a product specialist at Reprosci, who will be presenting the simulation in action, the fertilator, after the panel discussion. We welcome everyone. Thank you.
So this is called bribe before the action. You give it before we have done some work. You just had a master's course, first chapter on simulation. I'm a primary teacher. All right, so I'll go through the basics. So simulation, apart from the learning, we all learned driving and we know how we learned. Sit on the chair, dauda do, ek aath thok peet denge. Okay? But if you look at the real way what a simulator can do are those rare cases. If we have never been taught what happens if the brake fluid fails. We've never been taught. We've never been taught when a sudden a cow comes or a pedestrian comes. These are the conditions which are possible only in a simulated condition. You can never probably do that in a real case. So that's my primary teacher job. But thanks a lot to everyone. Simulation is, for example, in the case of Reprosci fertilator, I don't know whether they're rare cases. And in medical terms, we don't know. I'm not a medical guy. But I would imagine if a woman says, I'm playing hide and seek with the doctor. Come and catch me if you can. Right? Can you simulate a condition like that? And with that, I'll ask you, there is a gentleman here, Ravi, Shankar and Swami. Kitne log hai yaar isme? Ravi, Suraj, Shankar Bhagwan and Swami ji bhi. So, he takes all the positions in this college that we are running. But let me tell you, if you were to continue in neonatology that you are expert in, what made you switch over to simulation? I mean, what excited you to get into? You could have gone in neonatology, or was the competition tougher in neonatologists?
So, good question. Yeah.
One of the things that we all know is if you add a little bit of humor, you will remember it longer than one day.
Okay. So, neonatology has always been my passion, and people who work with me still know that neonatology still excites me. That is what gives me the adrenaline on day-to-day online. But at some point, you start looking for newer challenges. But the thing what made me go in simulation was like from 2001, I trained completely in the UK, and working in London, I thought, oh, this is the best place, and I can manage every patient to the core, to perfection. But then in 2011, still in doing my training, I was still doing so many errors are happening. In London, I thought I'm in the best place and errors are happening. And we know what to do, but it's not being done. So the problem, what I realized is that we all know what to do, but the problem is we are not able to do it. And that implementation failure is where the opportunity was. So what I started looking is, okay, can I teach my team if you want to get a baby from place A to place B without letting the baby get cold, because that was the simplest problem. All these preterm babies, they were born in labor ward and bringing them to ICU. They were born at very good temperature. By the time we could get them to ICU, they were all cold. And once they are cold, all problems starts. So my first simulation was, can I get a baby at a temperature of, let's say, 37 in the labor ward to 37 in NICU? And I did this complete experiment, and I thought, okay, we all have knowledge, but we have implementation failure. So let me just work on implementation. So from that time, simulation has come into a bigger place, but I've just been using one for implementation failure.
You silently said I am foreign returner, UK. So if you were in UK, tell me your collaboration between international and domestic collaborations. What were the results of these collaborations? We do understand in the innovative ecosystem, without collaboration, things don't move.
Correct.
Your experience on that?
So collaboration is currently for building this fertilizer. Collaboration has been with multiple academia and also people in India with Garbhagudi collaboration. We also collaborated with the Singapore General Hospital and also my colleagues in the UK to how to get things done. I'll give one more simple collaboration. So when we were able to get these babies from our labor ward was in the second floor, and the babies were in the 8th floor, I mean, in the NICU was in the 8th floor. We used to lose almost 20 minutes for the transfer. So we called the Ferrari team. Okay, they came to Royal London Hospital and they watched us how we do. And they gave us how we can reduce the transfer time. And simple things what they suggested, which I had never thought of. So we think we know everything, but when you get someone else to come and talk, then we get a lot of idea. So here for fertilizer, we thought, oh, we know this is how it should be done. But then we stopped talking to people and then they, okay, this is not right, oh, this can be better and stuff. And that's when we started fine tuning multiple things. So lots and lots of brains have gone into this. Just not one person, but lots and lots of brain. And thank you to everyone from Garbhagudi as well who have been very helpful in fine tuning this. Yeah.
Hari and Srinivas, double god, bhaiya. Dar ke rehna. But tell me, Hari, Srinivasan, what was the strategic reason that you adopted these high fidelity simulations?
See, we are not just a IVF center which treats patients. We are also in the Academy of Reproductive Science. Our vision is to build India's best reproductive health university. So from that perspective, we've always been on the lookout for partners who can help us build the two cornerstones of a university, which is academics and research. And the moment we met Vijay Gopal, Dr. Avid and team, we realized they are a very potent partner in trying to build something that can be on the cutting edge of doing things. Training, I mean, as all of you understand, the scalability challenge is always in the availability of the teacher and the patient in medical education. If something like the simulator could be utilized, the scalability challenge can be addressed much more quickly, and a lot of other challenges that are there, which Dr. Vikas explained beautifully earlier, all of those can be solved with the use of technology. We were able to, luckily we were able to connect with somebody like Reprosci very early, and we were able to work with them and bring to life.
What's your current experience of training in this?
Yeah, we have had the first installation at Garbhagudi already of fertilizer. Even prior to this, we have an ultrasound simulator from a different company. We've been using it for over 3 years. Very important point that Dr. Vikas mentioned, the average rating of a student when they pass out of a simulator-based training is always on a scale of 4.7 to 5. On a scale of 5, it's always between 4.7 to 5. So the level of learning, the sort of expertise that they're able to showcase subsequent to being trained on the simulator is very high compared to a pure human-to-human training. That's been our experience, and we will very strongly support simulator-based training from here on.
As I understand, this box also has an assessment tool in it.
Yes, very strong assessment tool.
So there's no human intervention, and if the professor has fought with his wife in the morning, he's in a bad mood. Marks come with
very good point.
It's a possibility. So good to have an assessment tool which is unbiased, neutral, and which can be standardized. Your point, because then you can replicate it across the globe. And you say a doctor from UK is as good as one in Manipal or vice versa. Sorry. So for both of you, what are the tangible outcomes? I mean, for you, because you're in training, there's a cash, right? Is there anything tangible in a pure academic and non-academic situations?
So what I'll probably say is that what we have built is just sort of a platform for people. It took us almost like 8 years to get here, lots of thought, but now it is available and we can build on very easily from here. So if someone comes and tells me, look, okay, you have a platform, you're building for the OBG people, can you build the same thing for a neurosurgeon? Yes, it's very easy. So I'll not take 8 years. I'll probably do it in 2 years. So we have a ready-made platform. It's now just getting to people, come back to us with what's your needs, and we can build a simulator for that. And the second thing is we can also build the learning management, not more than learning management, the AI, the bots, what Dr. Vikas told. You walk in, you get a personalized sort of showing a way what happens. So same thing, if a parent comes and asks me, what is autism, which is what our example I was giving to a person earlier on, Google will give you the entire thing. But they need some key questions. So my child is in third standard, he does not do this, and then the answer for that will be much more specific. So that is what we are also looking into. So this is something which probably what took us 8 years, probably now it will be much more quicker. That's one of the main message which I'll probably give now.
How about you?
See, I would divide the tangible outcomes into 3 sections. One is on the medical education, doctors who want to get trained on, let's say the fertilizer, on the process of IVF and how to do the ovum pickups or do the embryo transfers. So scaling up their skill set, certainly. As an organization, for me, adding more business is much more easier now. I'm not so dependent on star doctors to do the training. It's all a matter of what level of marketing I can do and bring in students now. Because I can simply keep adding fertilizers and do the training. So revenue wise, the scalability is there. But for me, the more interesting scalability on the medical education part is the depth of training that the student can have. So we can continue to add newer cases, more complicated cases into the fertilizer and keep making the whole training program more comprehensive as we move along. Let's say we start with 20 cases in the system now. But as we move along, let's say in my regular practice, one of the doctors gets a very interesting, very challenging case. We can program that into the fertilizer and make the depth of learning of a student much more, and scalability in that angle is also achieved. That's on the medical education side. On the secondary aspect of patient education that Dr. Ravi and Dr. Vikas and others were alluding to, one of the challenges with any other treatment, and especially in IVF, is to bring in that awareness to the patient, the couple, on what is the treatment all about. Making sure that they understand the process of the treatment much better. This system can, something like this can make that process very easy. Not exactly the fertilizer. We are trying to work with Reprosci on building a patient awareness module also, which is immersive. Making sure that they can go through the path of treatment and understand this much better even before they start the treatment process. That is on the second side. Third one is economics. Economics, certainly. I mean,
but let's for the time being keep fertilizer aside. What has been the impact on the broader ecosystem? The simulation, as he said about relationships. Is there something beyond this kind of activity that you can think of, the impact being possible in future?
See, one of the potential impacts that we are all looking at is a decision support system for the medical fraternity in terms of training them and also supporting them in their decision making process, right? So it's not just training very novice doctors in learning a new skill. It is also supporting them in saying, okay, if you take this path of treatment, these are the sort of things you will encounter. If you take this path of treatment, these are the sort of challenges you might encounter. The overall decision support system can also be embedded into the fertilizer sort of a process where the learning can become more immersive for the clinicians and the doctors also. That is one area. In terms of reskilling doctors, right? For example, let us say Dr. Vikas, for example, he moved into corporate line and then again came back into the practice. So somebody like that, or let us say there are cases that I'm not encountered for a long time. I'm a doctor, and let's say I've not encountered certain set of cases for a long time. Instead of trying to learn on a patient, I can again go into a simulator academy, learn a few things, and then again come and do the required modalities as prescribed. So these sort of systems can also be built in.
Let me go a little broader, broader than what you are talking about. Suppose you were to simulate a condition where a potential groom and bride were to get married. Could you simulate, looking at their attributes and characteristics, what will happen 5 years later?
Well,
is that a possibility?
It is definitely a possibility. It is definitely a possibility.
Vijay, kuch kaam karo yaar, rokda kamao. Psychologists and family counselors probably will, right?
Perhaps, yes.
But beyond the med tech device, what else you could do in simulations and training with these kind of technologies?
I mean, biggest thing will be breaking barriers. Like today, once upon a time, it was only be a doctor's course. It was one of the allied professional course. Today, we are in a course where everyone can come. So this is one of the biggest advantages of simulation. It is not just one person. You can break barriers and you can integrate. So because at the end of the day, which is what I keep telling my team, your focus is the patient. And if you can make that patient's experience good or improve the quality of care, what the patient is going to get, that's all, whatever we are trying to do will be finally the end result. So if you can make that better, not necessarily with one brain, multiple brains, and from different angles, they are all thinking in a different way, then that will be the best outcome for the patient.
So you might have all heard that there's a big influx of blue-collared people to Germany. They're short of manpower, right? One of the things that you could really think of training, not at a very senior level like doctors, but even nursing staff, there's a big gap between what is expected in, say, Europe, USA versus what is available in India, or even the language barrier. So I think that's also good business, isn't it? I mean, you don't need very high-end simulations of that, but that's a very large mass education you could do for simulation, right? So as we look towards the future of healthcare, how do you see the integration of simulator, XR, AI, computer vision, video analytics, all these technologies? See, we sit in a building which is a mix of all these technologies. Where do you see this marriage between all these things happening, going to?
One of the best example was how Dr. Vikas told the patient, someone goes in, everything
you can't steal his example.
No, I think that was one of the best example I would think of at this point of time. Apart from that, I think, as I told, whatever we are doing now, I mean, it's not going to be that we'll say next 5 years, next 10 years. It's going to happen in the next 1 year as well. And the thing is, of course, it's just the cost. And if the economics starts coming into picture and mass people start using, obviously the economics will start coming down. Then probably in a year's time, that thing will be true. I think that is the best way I can see it.
I don't get worried about cost because anything done in India is probably rupees versus euro. You know the difference. So I'm sure that if you try your hands on it, there's a lot of potential, I'm sure. Aap bataiye, what
See, one of the changes that I feel will come in. See, today simulator-based usage is driven from the corporate, the medical institution, right, the hospital. It will slowly transition into a patient-driven sort of process also. So the touch points that a patient will have with the healthcare system, all of these touch points will start having simulation-based interfaces also. Let's say I'm a patient, I've been advised a certain treatment, I want to know more. Instead of going to Google, learning more, or talking to, let's say, Gemini or ChatGPT, I can use, let's say, a video on YouTube or a simulation-based content and consume that content and learn more. So I can traverse through the awareness, consideration, decision stages and also experience the treatment even before I go through this. So the drive for content consumption will start moving towards the consumer rather than the institution today. That's the shift that we will probably see over the next 5 to 10 years.
But it will have a psychological impact on the doctors. They think we are gods. Now they will probably reduce that kind of thing. But I think that's a good. Any questions for these panelists? 2 questions, please. And the question should be the the tweet size, 144 characters, please.
Hello, this is more a challenge question to Hari.
Yeah.
See, you mentioned that this thing is easily transferable in terms of the training part of it, right? To neuroscience and all that. Isn't that too much of a stretch? Because these all these specializations are super specialized, very, very deep down, and you can transfer that knowledge into. Yes, you can reduce it to less than 8 years, but I just wanted to get some inputs from you on that. It seems to be a kind of a stretch of imagination that you can reproductive science to neuroscience, you can reduce that simulation cycle.
So I'll take a stab at answering that question. I'm not the one who's developed it, but I'll take a stab at it. See, technology, the concept of having a haptic device, considering the knowledge that you have, let's say an ultrasound based knowledge, and ensuring that the hand movements correspond to how a doctor needs to respond to that. So that's the underlying philosophy in the fertilator, and it's been designed for IVF business. But the underlying philosophy is pretty much the same, right? Let's say it's an orthopedic surgeon. The haptic device needs to be programmed in a slightly different way. The sort of screens that the doctor sees for doing that surgery related training has to be slightly different. But it's not going to be entirely different where you have to redesign the whole thing. Just a set of configurations as I understand, coming from a technology background. It's not going to be Control C, Control V for a new domain, new specialization, but it's not going to be starting from zero again. There will be a lot of relevant technology platforms that are already built, which like the learning management system, the assessment, all of that is going to be the same. It's just going to be the sort of use cases that are going to be fed into that. So did I answer your question?
Otherwise, take it offline, please. One question from a lady and one question from a backbencher.
This question is to Dr. Ravi. Simulation, I am also a neonatologist, I am working with you. So, will medical practice or the doctors be replaced by simulation? The threat to a medical practice, can it be that? I'm just asking because I have been attending lots of simulation conference recently and we always have a question. Will we be replaced or who? I mean.
Shall I say? No. Absolutely no. It's a tool.
I think I completely agree. The short answer is no. But what we can say is that, apologies for that, it's a good combination. So if you want to achieve a goal, I'll keep it away. If you want to achieve a goal, I'll probably say if you're alone, instead of you being alone, you have one more person along with you who help achieve the goal. So I would probably say you will not be replaced, but you will be augmented.
Simulation will be a complement to actual doctor.
One question. So, we have implemented VR and simulation in manufacturing, like in manufacturing processes. So, how do you see this versus, in fact, the cost and efficiency with respect to the robotics? Like how if you compare both of them? So so maybe, we don't need to train people, we just need to have robots performing that, which is something which is like, simulation is there, maybe, it is replaced by robotics. How you see? Because in automobile, you already see this.
Healthcare is not it's not the same. Every human system is very, very different. So a robot can be certainly programmed, but you will always need a human doctor to be taking those decisions in support with the robotic system. That's how I see the system. Probably not as close to completely automating. I mean, doctors should probably tell that. I feel each human system is so unique, so different, that programming a robot to entirely take over the treatment process, a procedure, and then also face the aftermath of certain decisions, right? There has to be somebody's neck you want to choke when things don't go right. So a robot cannot be that. So. Yes.
Just saying that simulation is a trainer and robot is a task performer, and both need an intervention, at least a guidance or validation of either the completion of simulation or the correctness of the task to be planned, and validation of the task by a human being who's trained in it.
I have one last question. This is a technical question for the team that has developed this. It's a wonderful job over the years of 8 years. My question is relating to the advancements of the evolving XR and AR technologies and the gadgets that are out there. This haptics looks very neat. While the complementing AR headset, I see this might be the Meta Oculus 2. So now we have the Meta Oculus 3 and also the Vision, Apple Vision Pros is out there, and Mark is set to release the next AR gadgets. So would those gadgets with the advancements complement these haptic machine, or would this be only with the Oculus 2?
No, I'll probably say that change is constant, isn't it? So if we don't adapt to the newer technology, we'll be redundant. So although we just have 2 modules at this point of time, our aim is to bring multiple modules. Similarly, from where the fertilizer started, if you see version 1, you will be completely surprised from. So I've seen from version 1, from where it was built in IIT Madras, where we were seeing how it was, to what I see is a huge change. 3 years down the line, we will be laughing at this, what a dabba machine we made. And 3 years down the line, things will change. So that's how it is. That's how the world is evolving. We have to catch up with them. Otherwise, we will be completely thrown out.
Right. Thank you so much.
All right. Thanks a lot, my dear panelists. And if they all done good work, clap for them. And if they've done good work, let me now give them the bribe. Okay. Thank you. Thank you very much. Thank you very much for coming. All right.
Sorry, you forgot one.
No, that's mine. Thank you.
Thank you, sir. Guys, can you put this back? Yeah. No, it's okay. For now, you leave it. Are you presenting something? Are you presenting? No, do you need a projector? Thank you so much to all of our panelists and our moderators. So, Mr. Navratan Kataria, Dr. Ravi Shankar Swamy, and Mr. Hari Srinivasan. Now we have Ms. Varsha, the product specialist at Reprosci, who will be presenting the simulator in action, the fertilizer.
Hello, good evening, everyone. I'm Varsha, product specialist at Reprosci. I would like to show you how fertilizer exactly works. Just have a question for all of you. Does everyone understand what IVF is, what the procedure altogether is? Okay, so I'm just going to briefly explain. So for treating infertility, there are various procedures, and one of the procedure is IVF. And in IVF, there are many steps that are involved to make sure that the infertile couple is able to have a baby. So one of the procedure here that we have built the simulation for is called oocyte retrieval or egg pickup. So in a female reproductive system, we know it has 2 ovaries, and in a normal condition, when a woman goes through her menstrual cycle, there is an egg produced every month, which can get fertilized and become into a baby. So for those, or let's say a man who is having challenges with or infertility problem, or a woman who is not able to fertilize these eggs, then the treatment that they would opt for is probably IVF. So what happens in IVF is that the female undergoes various steps where they are given hormonal treatments to enhance the growth of the eggs, such that in a monthly cycle on a normal condition where one egg is grown, in an IVF wherein during oocyte retrieval procedure, there are multiple eggs that is growing inside the ovary. Let's say on a normal basis, around 10 to 20 follicles are grown, both put together in the ovaries of the patient. So I'm just going to show you how it works in the fertilator. So in fertilator, we have something called as a transvaginal ultrasound probe. So this is the transvaginal ultrasound probe that goes into the vagina of the female patient. And on this ultrasound probe, we have the needle that is attached to it. Through this needle, we are going to retrieve the eggs out of the ovary, which will be sent into the lab for fertilization. So this entire technique is performed through ultrasound. So this is our dashboard, the student dashboard. As when they log in, they have different, they can look into different parts of the dashboard where you see learn, practice, evaluate, reports, and many things that are displayed on the screen. What we have is a end-to-end learning platform. The first step on how to use this simulation, what is an ultrasound, what the learner has to do when they go into the patient on doing the procedure. So the entire steps are involved in doing the procedure is taken in this particular platform. So the first step is learn. First, we show them how the female reproductive system looks like, and when they maneuver the probe inside the patient, how does the probe move inside near the ovary, and how they can retrieve these eggs. So this is system diagnostics, just to keep in check with all the connectivities. The patient on the bed, and also you can see the ovaries with the vagina close to it. Yeah, so the probe is in action right now, and you can see the probe has to reach the cervix and then maneuver towards the ovary, either one of them left or right, and try to stabilize the probe in such manner that they are able to retrieve the follicles or the follicles from the ovary. So he has pinched the needle through different tissue layers, the cervix and the cervical wall, ovarian wall, and the follicles. So our system is equipped with haptic feedback. So every time they are moving the probe, they can feel slight resistance. And every time they are piercing through the walls, they will also feel the pinch effect, literally how it happens in the real-time scenario. So this is an anatomy case just to understand how the procedure actually works inside the patient. So now we'll go into the ultrasound mode. So there is an organization called European Society of Reproductive Health and Embryology. Various doctors from around the world have come together, have built a guideline, good practices in ultrasound oocyte retrieval. We have adapted that particular paper to train the students on this particular procedure. So this is the ultrasound screen, and you can also see the patient on the other screen. So every step that is performed by the student, they can track their movements on this OPO task tracker that's on the right over here. And they can also track the ultrasound probe movements just so they know where they are inside the patient, and they can maneuver and stabilize it, and also retrace and practice as much as possible to perfect those movements. Now we'll go into the patient, virtual patient. Yeah. So, so we have 6 degree of movement for ultrasound probe. You can move in any direction you want, and 1 degree of movement for the needle. So to be able to retrieve the follicles from the ovary, a suction pressure must be applied through the suction pump or the foot switch over here. So the learner is supposed to apply suction pressure to be able to retrieve the follicles. So the first step is understanding how to scan in the ultrasound, locate the ovaries and the follicles. So now, as you can see, we have located the ovaries with the mature follicles. So like how I mentioned, in a monthly cycle for a normal patient, they will probably have 1 mature follicles which will get fertilized. In the case of an infertile patient, they do hormonal therapy, which induces the growth of all the follicles in the ovary. So that is why you see too many follicles in the ovary, which the doctors or the learner is supposed to take all the follicles out, which may have a good egg that will qualify to become into a baby in the future. So now we are going to pierce through the needle. And then when we approach the middle of the follicle, we have to aspirate or retrieve the follicle. Every time a follicle is aspirated, it is collected in a test tube. And you can also notice how precise you were while you were doing the procedure. So if the learner was very good at aspiration technique, the fluid that is collected in this test tube will turn green, meaning the hand was very stable while they were aspirating, and they were not collecting any liquid around the follicle. So every step, every mistakes or any errors that is connected during the procedure is tracked by the system. In case the student did very swift movements inside the ovary, or they were not able to identify the structure of the follicle, or got confused with the blood vessel that goes below the ovary. Blood vessel. Yeah. So the big shadow that you see under the ovary is the vessel. So they have to be very careful while they are aspirating the follicle and not go near it. And if they did puncture, they have compromised the case, and they will have to restart the case and relearn. So there are many, on a simulation, even if you did a mistake, you can try again and practice and stabilize your hand movements, which is a challenge when it comes to a real-time patient. So this has to do with what the procedure is and how a learner learns how to do the ultrasound scan and also retrieve the follicles. This is in the case of normal cases. Consider cases which has underlying complications like endometriosis or adenomyosis, or even one with a cyst. So that requires a lot of decision making before they take the patient into the operation theater and understand how to maneuver in the ultrasound scan and decide where do I start my procedure, which direction. All of these decisions can be taken in the ultrasound, and then they can start the procedure. So we do track even decision making of the student while they are doing the procedure. Now we'll step into a different case. Absolutely. So what we have done is we have referred to real patient cases, recreated them with our ultrasound imaging system, and that is what you see over here. This is a normal case where the underlying infertility problem is with the with the male patient, not the female. So we also provide subtle information on what was the underlying infertility condition. We also share those information in the system. Yeah, so what you saw right now is the entire procedure is in non-immersive mode without the virtual reality. We also have the same in with the virtual reality where you wear the Oculus Quest. Yeah. Anything. So when they choose let's say a case with polycystic ovarian syndrome or the one with a simple cyst or a chocolate cyst, decision making is very important. So in the case of cyst, some doctors prefer to remove the cyst first and then aspirate the follicles, or some doctors would not go near the cyst. They would just go about taking all the follicles outside from the ovary. So even those decisions can be looked into, how the learner why they came upon those decisions can also be looked into in this particular system. So now he is wearing the gear, and you can also create scenarios in virtual reality where you have all the steps involved, monitoring the heart rate of the patient, even the anesthesiologist, how he is tracking the patient, whether she's sleeping or she's moving during the procedure. And also small things like setting up your surgical instruments to cleaning the vagina before they start the procedure. All of these things can be implemented in virtual reality. So the same thing that we saw in non-immersive mode is in immersive. So every time a learner is performing this procedure, there's a real-time metrics that's flashed on the screen, how many follicles they have aspirated, how many they have compromised because of poor hand stability, and what is the probe's transition. If they have applied too much pressure to the cervical wall, then the probe transition color will turn to red, which means they have to maintain less pressure on the wall. So all of these information is shared during the procedure here. So now that you have witnessed this, let's say we have completed the case. By the end of the case, a report will be generated and which shows the basic metrics of how the students have performed the procedure. Can we end the case? Yeah, so the report shows what was the time taken to complete the case, number of follicles aspirated, compromised, how many follicles that were present in the case, for example, like 17, follicles collected is 3 and compromised is 1. And also, if the hand stability was poor, we have something called as blood aspiration count, which is instead of retrieving the follicle, they pierce in the stroma and they try to aspirate the tissue around the follicle. Then there is some amount of blood that goes in, so we count that value as well. And the total of every movement gives the aspiration efficiency, which is right now 15%, which can go, it's different for different cases, 90%, 100%, and many more. So if anyone's interested, can also have one hands-on experience on the system by the end of the session or during the break period. Any questions? Thank you.
Thank you, Ms. Varsha, for that very insightful presentation. I would also like to tell all of you that we are going through like a live telecast. It's on NewsFirst's Prime YouTube channel, and we've shared that link on all WhatsApp groups and all channels. So you can also join us there. Let's shift our focus now to artificial intelligence and how that is revolutionizing the learning and organizational outcomes. Spec Health Learning Experience Platform, which is powered by Menventra AI, represents the cutting edge of AI-driven educational tools designed to enhance the learning experience and improve overall organizational performance. To guide us through this exciting topic, we have Ms. Bhuvana Kumar, the Chief Learning Officer at Reprosci.
Hi, thank you. Thank you for this opportunity. Good evening, everybody. My name is Bhuvana Kumar Ramamurthy, and I have been an entrepreneur in the tech industry for over 2.5 decades. So today I'm going to talk to you a little about AI-powered learning in healthcare. I think everybody has spoken a lot about the other areas, right, when it comes to simulation. Okay. Yeah. So, I'm going to talk more about AI because that is an area that we specialize in. So, I think first let me start with the story of Elaine Bromley. So in 2005, Elaine Bromley, a 37-year-old mother of two, she went to a hospital in the UK for a routine sinus surgery. Elaine was generally healthy, but the procedure required general anesthesia. What should have been a straightforward operation turned into a tragic event that would change the medical training forever. During the anesthesia induction, the medical team encountered unexpected difficulties. For 20 critical minutes, highly qualified doctors and nurses struggled to intubate Elaine. And despite their efforts and years of experience, they failed to follow the established protocol for the scenario. Unfortunately, she never regained consciousness and passed away 13 days later. So the most heartbreaking aspect of this story is that Elaine's husband, Martin Bromley, was an airline pilot. In the aviation industry, simulation training and crisis management protocols were standard practice. Martin couldn't understand why similar training protocols was not available in the healthcare industry. He worked tirelessly to bring aviation-style simulation training and human factors education into healthcare. He founded the Clinical Human Factors Group, which advocates for better safety practices in medicine. Now imagine if Elaine's team had access to AI-powered simulation training. They could have practiced this exact scenario countless times with the AI adapting the simulation to challenge them in new ways every time. They might have developed the muscle memory and team coordination needed to swiftly act in a situation like this. That is the power of AI and simulation in healthcare training. It's not just about knowledge, it's about being prepared for any scenario, no matter how rare or unexpected. It is about saving lives like Elaine's. So what does the story of Elaine Bromley tell us, right? Elaine Bromley's story highlights a crucial truth in healthcare. Knowledge alone is insufficient. We must bridge the gap between theory and practice, between knowing and doing. This is where AI-powered learning platforms and advanced simulations are revolutionizing healthcare education and practice across various sectors. We are entering into an era where AI and simulation are becoming integral to healthcare professional training. While exciting, this transition also poses a lot of challenges, and it is very difficult for everyone to adapt it, in a very fast way. So they must keep pace, the healthcare professional must keep pace with the expanding knowledge, master complex procedures, and make quick decisions in high-stake situation. Traditional training methods, though valuable, often fall short in preparing practitioners for these nuances, right? So AI and advanced simulation aim to address these challenges, transforming how we prepare healthcare professionals for the complexities of modern medicine. This technology promises to enhance not just knowledge but also the practical skills and decision-making abilities in critical situations. So what is the need for simulation and AI in healthcare, right? Everybody understands that it is becoming very complex, and with complexity comes the risk of human error. And here the errors are something that can have life or death consequences. So artificial intelligence with advanced simulations offers a very transformative approach to medical education and training. So we can create personalized adaptive learning experiences that evolve with each user. Like ma'am just spoke about it at the beginning of the session, where she spoke about personalized experiences, right? And you can have advanced simulation, which Dr. Vikas spoke about, which provides a risk-free environment to practice critical scenarios and honing skills. So that is the reason why we need to have simulation and AI. Now, let's talk about the use cases that are related to AI and simulation in large hospitals and clinic chains. So these technologies are improving everything from diagnosis to patient communication. So in diagnosis, AI systems can analyze vast amounts of medical data in seconds, augmenting human expertise. For emergency response, AI-powered simulations create immersive adaptive training experiences that prepare staff for high-stakes scenarios. AI is also transforming patient communication. This is very, very important, right? In large hospital chains, AI-powered uses natural language to provide real-time feedback on staff-patient interactions, enhancing empathy and clarity. So the benefits are clear. Finally, it is all about the patient outcomes. So if with improved patient outcomes, reduced errors, enhanced efficiency, and increased satisfaction, the AI systems continuously learn and adapt, ensuring an ongoing improvement in hospitals' performance. So this is the reason why the future of healthcare is AI and simulation. It is smarter, more responsive, and more humans. The question is now, how quickly can we integrate these technologies to better serve our patients? So medical education, obviously, I think everyone has spoken a lot about the reasons why we need to have simulation and AI in medical education. But I think I'll just quickly cover this up. So we have reinforced learning, which is like AI-powered tutoring systems. They can personalize learning using active recall and scenario-based applications to help professionals truly internalize knowledge. So communication skills, role-play chatbots, simulate the diverse patient interaction and providing safe environment to practice critical conversations. Language barriers, multilingual chatbots serve as always available tutors explaining complex medical topics in the learner's preferred language. And this is something which is very important. Skill evaluation, adaptive testing systems that automatically adapt based on the user's knowledge level. That is also something which enhances a professional's capabilities. And then career progression, AI can recommend the career paths for the professionals on what is it that they can do next. These innovations are democratizing medical education, making it more accessible and effective. They are not just changing how we teach medicine, they are reshaping how we approach continuous learning across healthcare. So it is the challenge, our challenge now is to embrace and integrate these technologies to better serve our patients and advance healthcare as a whole. I think in medical devices and consumables, again, this is an area where AI can play a very, very big role, AI as well as simulation for device usage training. So if you need to be trained in using the devices, right? So the time to get proficient for a new product launch or a new product, for the salespeople to go and sell a new product, or even for the doctors, this is something which is simulations really help in a much easier and a better way, right? So, for example, cardiologists can learn to use complex pacemakers through virtual representations, improving patient safety and reducing liability risks. So it also offers just-in-time support in clinical settings, allowing surgeons to quickly review procedures and troubleshoot issues. Then it allows for safety protocols to be reinforced, including safe disposal of medical consumables and waste management, and also for regulatory compliances. So these technologies are not just enhancing training and safety, they are catalyzing innovation, streamlining regulatory compliance, and ultimately improving patient outcomes. So the integration of AI and advanced simulations in medical devices and consumable sectors is catalyzing innovation, streamlining regulatory compliances, and ultimately improving patient outcomes. So let's just turn pharma industry. Of course, I think we have ma'am that has spoken a lot about the need and the opportunities that exist for simulations in the pharma industry. But then these are the four main areas where we think that it can really make a huge difference. So imagine a medical representative preparing for a crucial meeting with a busy oncologist. Now in the past, they might have spent hours poring over product manuals, clinical trial data, and hoping to anticipate every possible question. Now they have an AI assistant right in their pocket. Enter the AI-powered Q&A chatbot, a game changer for pharmaceutical sales. This intelligent system doesn't just regurgitate information, it understands context, recognizes patterns, it frequently asks questions, and provides nuanced, up-to-date responses for specific questions, and by understanding the context. So it is like having the entire medical team, medical affairs team in the rep's pocket, and the rep can answer any complex question on the spot, making every interaction with the doctors more productive and meaningful. The next is about the role play based training for product presentations and sales pitches. AI is revolutionizing this part as well, wherein the sales rep can practice with a chatbot and then can deliver a sales pitch to the customer fully prepared. So I think the future is definitely something where it is going to involve AI to a very, very large extent, and especially for the pharma industry. So I think let's just conclude. So as we conclude, let's just understand what are the different ways in which we can implement and we can adapt these systems, right? So we imagine, like, if we have these AI assistants seamlessly integrated in our daily medical practice. This isn't about doctors, about robots replacing doctors. It's about intelligent systems empowering health professionals to be their best selves. So if let's picture a young resident making rounds in a busy hospital. She approaches a patient with a complex set of symptoms. As she begins her examination, her AI assistant is already at work analyzing the patient's history, latest test results, and relevant medical literature. It whispers insights into her ear, suggesting potential diagnosis she might not have even considered, flagging unusual drug interactions, and even providing real-time language translation for better patient communication. The AI isn't replacing her medical judgment, it's augmenting it, allowing her to focus more on the human aspects of care while having the world's medical knowledge at her fingertips. it's like having a team of seasoned consultants by her side. So this is the future that we are talking about, and this is not something which is very far away. It is already here, and we are going to see these kind of interactions probably in the next year or so. So, we can start today. We are here. The entire team at Reprosci is here to support you all in your journey to start with the simulation and AI. And let's not just witness this transformation. Let us just lead it, right? I think that is where we can become the leaders. And this revolution, it needs you. It needs your expertise, your experience, and your human touch. So thank you so much. I think before we conclude, I'm just going to show a small demo of the of our AI-powered learning platform. If we have time, we have. Do we have time? You don't have time? Okay, fine. I think then I will just conclude and we can do this later, right? Okay, thank you. But, the demo I would have actually, I think let's just do it for 2 minutes. I think we can just, yeah, okay, fine, I think. Take minute.
Which is
Sorry, yeah. So this is basically our learning platform. This is the dashboard here. And what we have here is, I'm just going to quickly run through this. We have a lot of features, so even if we sit all day, we may not have time to cover everything. But I'm just going to quickly go through some of the features that we have, right? So all these courses that you see here, these are all created by AI, right? So if anybody has got any topic on which you want to create a course, somebody wants to suggest something, I can show you how exactly this works. How to build a human clone, okay, that's interesting. Okay, let's see what it produces, but that's a very controversial topic. It may even throw me out. Okay. So it has created this scaffolding for the course: Introduction to Human Cloning, History of Cloning, Basic Principles, right? So it has created this structure. So this is like the first level that you would do when it comes to creating a course, right? Which is to create the structure. Then this is my course metadata. It has generated this description here, and then we have the different you can generate the learning outcomes with AI. You can generate the skills that it would deliver, the job profiles, and then we also have this virtual tutor. So basically the chatbot which I was talking about, we already have that in the system, and it is something which the users or the students can leverage to ask questions. And then you can just go here and you can generate any content. So what is the history of cloning? If I want to go and add the content here, I can just do a drag and a drop, and I can say add content. I can say let's sit in. Yeah. So once this content is generated, once the content is generated, then we have to design this, so we can use this visualizing tool which comes with it to see how the content has to be visualized. So we have different options. You can generate games, you can generate different kinds of looks the way you want it. So let's say I want to rewrite this content to explain the concept as a story to a 9th grader. So I can just select this. There are a lot of options, but I'm going to quickly wrap this up, right? So now let's see what it comes up with and how it looks. In the meantime, I would like to go to this section, which is basically the learner section. And here I will show you how the chatbot works, right? So this is the Q&A chatbot. So the AI basically extracts content from different sources. So whether you have the content in your text file or a PDF file or videos or audios or images, it will extract all of that content and it will enable the user to ask any kind of questions. So here, let's say that this is my course here. I will say yes. So if this is so I have a content here which is embedded, which is a 98 page document, right? So it is on global strategy on infection and prevention. So if I want to ask any question in that one, let's say I'm in page number 75, okay, not maybe 75, let's go to 55. Okay, IPC knowledge, and I want to ask some question about this one. What does IPC develop IPC curricula, it says, right? So I can just go here and I'm going to ask the question here, and I can do this in any language, right? So my content is in English, but I am going to ask in Tamil. I speak Tamil, so I'm going to ask in Tamil.
How many language support is there?
54 languages right now. So IPC curricula in so it has found the answer, and it has also done a real-time translation, and it will right. So so it translated, it found the answer, it did the translation, it understood the question, it understood the context, which is very important, and then it has generated this response, right? So it becomes very easy for anybody to interact with the system. Now, let's just look at another part, which is the role play part, right? So which we just spoke about few minutes back. So here I have a role play. Here I have a role play chatbot. This is kind of a custom chatbot which we just created, before for this session. So this is like you're training a nurse on duty for conversation skills, right? So here also I can have multiple languages. So here I'm going to do Hindi and English. I'm going to do female. ओके मेरी तबीयत ठीक नहीं है इसीलिए मैं हॉस्पिटल आई हूँ. मेरा नाम मीनाक्षी है और मैं 40 साल की हूँ. मुझे 2 दिन से सर में बहुत दर्द हो रहा है. पता नहीं मुझे ब्लड प्रेशर कितना है. So the point is that this will just keep going and it will ask. So it will just respond interactively based on the user's responses. Now the purpose of this training is for the chatbot to have a role and for the user to practice. So we could do the reverse also, where I could be the nurse and the chatbot is acting up like a patient, right? But basically the point here is that you are training somebody in conversation. How would you approach, like if you need to have empathy when you're interacting with a patient, what are the words you would choose and how you would do that? So that is what I wanted to demonstrate. We are running out of time, so I think I'm going to just go back here. Yes, please. How do you address hallucinations? So this is the one which I demonstrated to you. These are the specific data sets which has been created from a data source. So when we train the bot, we can set an epoch level. So at the epoch level, the higher the epoch level, the more it will conform to whatever is the data set on which it is trained. Right, so it depends on what exactly is the purpose of the chatbot. If the chatbot is for training somebody in, let's say, English communication, it means that I can use a custom data set, plus I can leverage the intelligence which already exists in other LLMs to train them, right? So the context and the purpose is what, and it does not use LLM. All these is running in our servers. We have customized, we have customized these LLMs to work the way we want it to work. Yes, please. Thank you. No, it is not. That's what I was wanting to do. It is not ChatGPT. So we have customized and built our own models for this to work. We leverage the LLMs which is already trained. Say, for example, we are, there are millions of different models which are available. Whichever is the model that fits in, we work with different models, and then we train it based on the requirements, right? So whichever is the model that suits the requirement, we use that. But it is not in the, like, none of this data goes to OpenAI or any. It all remains in our server. Current size of data, so it depends whether it's a small model or a big model. So if we don't use big models, we actually use small models, and we keep experimenting it. Now this is not something which we have created. We are using the models which are already out there to work on that, to work over that, to make it to work the way we want it to work. So we are not really creating our own custom model from scratch, because there is no purpose and it is very expensive to do that.
So for different set of models, you are using different set of customized data?
That is correct. That is right.
On top of that, you are building?
Yes, correct.
Parameters,
based on the parameters, absolutely right.
And madam, how would you evaluate the responses? I mean, you said like you're training it with your...
Yeah, so that's right. So yeah, so there is a threshold. So basically what we look at is, we have, once we get all of this data, there is a threshold which is defined in the code. So if it crosses a certain threshold, then it is something which gets alerted to us, and then we actually go in and see whether the responses were correct or it was incorrect, or what is it that went wrong, right? But this is something which is evolving, and this is something which I guess, it will take time for us to stabilize that. Right? So anyway, I think this is something which it did, history of human cloning. I think we can, so it is still generating. This is the content which we generated, it designed it like this, right? Whether we like it, if we like it, we can keep it, or if we don't, we can just go ahead and we can change it using the authoring tool which comes with it. So if there are no more questions, then I think I would like to pass it on to the next speaker. Yeah, thank you.
Thank you, Ms. Bhuvana Kumar. That was surely, I'm sure that it lit up a lot of bulbs in our heads. And I'm sure that we're all very hungry, but we're going to wrap this up in like 30 more minutes. So I hope you stay tuned for that. Next, we have something called XR in action. So we've seen immersive technologies such as extended reality, and these are opening up new dimensions in healthcare. They're offering new innovative ways to visualize as well as interact with the medical data and train professionals and engage with patients. So now we have a session by Mr. Pramod, the Chief Experiential Officer at Reprosci, and he'll be exploring the practical applications of extended reality across the various aspects of healthcare. I invite you on the stage, Doctor.
Hello, good evening everyone. Thank you for staying late. And it was raining today, and you guys have made it till now. It's the last session, and you guys are here. I'm very grateful for that. A big round of applause for all of you. Okay, so like XR, before starting XR, isn't it fascinating that the technology is evolving very fast? Do you guys agree with this? So I was just seeing the things that Bhuvana shared. It was really amazing. Right, and there are a lot of use cases. There are a lot of things that is happening with the technology today. And XR, how many of you are aware about XR technologies? Awesome. You have some good numbers. That's great. For the people who are new to this technology, let us talk about it. XR itself is a bunch of offering coming together with virtual reality, augmented reality, and mixed reality. So let us imagine what is virtual reality. Okay, I'm here. Okay, I want to experience I want to experience London. Okay, sitting in Bangalore, I want to experience how the London is looking. Okay, how are the streets? What exactly I can do? Okay, imagine you are sitting here and you are wearing glasses. You are teleported over there. Okay, you can realistically see the streets. You can realistically enjoy the 360 environment. Okay, this is something that virtual reality offers. Okay, and what is augmented reality? So let us come to that. Augmented reality is something you are in a real world. You guys are sitting here. You want to bring something in front of you. Okay, it's pretty much impossible, right? Using goggles, AR goggles, or your mobile phones, you can bring something right in front of you. Okay, that is augmented reality. Okay, and mixed reality, you're virtually present. You can augment the object in the real world. Bringing this together, it's a combination of virtual reality and the augmented reality. It's a mixed reality. So, any questions? Anything about this? No, right? Yeah, good. Awesome. So why XR? Why this guy is coming up in the late and discussing about XR now? Why now in this tech forum, in this healthcare forum? Yeah. Okay. There are use cases, a lot of use cases for this. Okay. Why XR? Can somebody tell me from the audience? Yeah. Yes, Bhuvana.
See, the use case that you mentioned about experiencing London, I have experienced that. I experienced Paris sitting at home, right, with the Quest headset when I was unwell and I was confined. I was confined to home, right? So I think those are the kind of use case. So leisure is definitely one of the use cases, and then the other use cases is from the business perspective to make it more realistic, whatever you're experiencing.
Awesome. Thank you. Okay. So let me give you the examples that you guys can relate. It was a wonderful, wonderful example. Okay. Yes, imagine a surgeon who is coming, a new aspirant surgeon who's going in a OT to perform some surgery. He has to perform something. There are simulators. I completely agree. There are a lot of simulators available, but still, when they are going to go in the OT, that feel is never there. Okay, with the virtual reality, a surgeon wearing VR glasses, we are teleporting, just like London, we are teleporting him to a OT, and he's going to experience the patient lying down in front of him, and he's going to apply all the knowledges that he has gained so far. Okay, he's coming there, he has to, there are check boxes. Because it's going to be a critical aspect that he needs to take care. So there are check boxes that he needs to tick when performing a surgery. So all the check boxes, he's himself is doing it. Okay, he is performing what are the best practices that he has learned. He is applying his skills. Okay, and he is performing what exactly that he is going to do it. In the OT in the coming future. So that is how these XR technologies can help. And one more great example is for the medical students, they are going to study the hefty books. Okay, where I come from an engineering background, I don't have to I did not study that much that you guys have done. Okay, but yeah, but all the things that we we under the things that we read and the things that we do are completely different, right? So in my case, like whatever I learned, applying the knowledge in the industry was completely different. Okay, but you guys are dealing with a life, so you'll be knowing more how this textbooks, the knowledge that you have gained, you have to apply it. But with the XR technology, you can literally do the things and you can learn it. This is what all the point I was coming to. Okay, there is. I want to show you something amazing. Not this one. This is one of my favorite American TV show, that is Good Doctors. Hope many of you have seen already. Okay, here there are two amazing doctors. The actress, they are performing a complex heart surgery. Okay, where they know it was very complex that they were performing on a kid, where a minor error can kill that kid. Okay, what they were doing is these guys are wearing a mixed reality headsets, where they both are collaborated on a same surgery, and they're actually performing the surgery here. Okay, before going to the real before performing it on an actual patient, they are performing it here. They imagine the confidence they can get after doing this and going to a OT. The precision, the confidence level are pretty much amazing, right? Okay, so I was a part of a survey, okay, where how exactly XR can deliver the outcomes. Okay, what we learned from that survey is XR is 4 times faster than what exactly you learn in the classroom or an e-learning or on the e-learning platforms. Okay, imagine we are coming back to the same point that you have to go through a lot of details on the classroom. You have to be you are mostly distracted, either you are looking into your friend, what exactly is doing in the classroom, or somebody might be hitting on someone, or there might be lot of distractions over there. Okay, wearing a goggles, you're completely immersed and you're on your own and you're doing the things. Okay, so that is something what VR offers. Okay, and in the survey, how it is 4 times faster is what I explained, and the people who were part of that survey was they were on a they were 275% more connected to what they are learning. Okay, and along with this, the time that they spent on the time that they spent on the virtual reality training, they were more connected with that. Okay, this is what this technology is offering. Okay, and okay, let me show the videos instead of how it looks. Okay, we all know that there is a lot of shortages of a healthcare caregivers. Okay, where mostly in like Europe and UK, there is a lot of shortages. Okay, and the people from here are going there. So this is like, imagine like if we are training this nurses and the healthcare caregivers, uh, caregivers, they like what they learn and how they perform over there, it's completely different because they follow the different guidelines from in the different countries. But if they can be a part of if it is a part of XR program, like the people can learn more and gain confidence, and they can gain confidence and they can perform it better. Okay, there are XR across the industries, like like the biggest market is the pharma, like in the pharma, how the XR technology can be worked, how it can create impact. Okay, like in the manufacturing process, like imagine there are a lot of machines. Okay, imagine that there are digital overlays of what needs to be done. The checklists are there, and they can, if they are making any mistake, it automatically tell them you are doing this wrong. So the error percentage is going to go down drastically. And the other thing is like when in the for the sales reps, definitely like they'll be coming to the doctors and they will be explaining a lot about their product. Okay, imagine that they can exactly show how that how their product looks like, how it can work. Okay, so it will be more convenient for the doctors, and it will be more convenient for the sales reps, where they have the power in their hands and they can showcase it. Okay, and quickly, like healthcare workers, like the nurse trainings, yes, definitely we talked about it. And the patient education is something very important. Okay, where when somebody is coming, when a patient is coming to a hospital, they'll come with a lot of doubts. Okay, so yes, I completely understand that it's a they are coming to the doctor because they do have the problem, but if we educate them in a right way, they'll be able to ask the right questions to the doctors. Okay, this is why the patient education is very important. Okay, and medical education and surgical trainings, I think initially I discussed a lot about it, so I don't want, like the people are telling me to cut off. Okay, and the surgical innovations and the medical devices. Okay, like while presenting over there, like a gentleman came to us, and he they are into manufacturing the medical equipments. Okay, like one of the best use cases, like when the doctors are using something, okay, or the surgeons are using something, they are more okay with what they are using. Okay, if some innovative products are coming, like it's a human nature to be reluctant. Okay, if we are able to show the doctors how our product can make difference, how it can be used, how it can make make the impact. Okay, then the decision makings can be much easier, and the doctors might suggest the new devices coming out in the market. So this is where it can help. And let's directly jump into the questions. Yeah. interesting. Like,
See, we don't know the long-term repercussions because we are just starting. We think that every technology coming out in the market is great.
Yeah.
It's like, a silver bullet for everything, right? So
Yes.
now, am I going, like, you showed a demonstration where, like, the doctor is getting assisted from
Yeah.
somewhere remote place, right?
Yeah.
If the doctor has lost the art in his hand, like,
Yes.
because there was something always there, then what happens?
So, like, we can consider it this way, sir. Like, we are not replacing anyone. Okay, we are just empowering them. Okay, and the way the technology can never replace the human. Okay, I'm a strong believer of this. The thing is, like, if we are using the technologies, and your question is, doctors might become more like more used to it, and they always need the assistance. This is what you're coming to, right?
If I keep assisting something, right? So there is a bias that gets created.
Yeah.
Right. The bias could be not empowering, but actually, slacking you as well.
Yeah.
So in that case, are we really creating good doctors? Let's say 15 years, 20 years down the line. If we have these technologies, these tools, these assistants available to us throughout,
Yeah.
what happens?
So
well, this is a question. I
Yeah.
think that it's a question for all of us. It's not
Yeah.
something like that you have to answer, but something that I am a psychologist actually. So
Yeah.
I would like to add a point here. Please. When people did the math just with the mind, everybody knew everything, like arithmetic and all of that, until the time the calculator was introduced. The first person to raise against that were the teachers, maths teachers. But today we can't think of doing some maths without Excel. I mean, we are far beyond calculators. So I believe that despite that, it's the CA who has to use that. There's a human factor to it. And, no amount of a calculator can validate any of the accountings. So likewise, I believe that the technologies that are evolving would eventually benefit the mankind with the touch of the doctors. And as the time goes by, we will all get used to it, just the way we got used to the calculator.
we have lived our lives in a certain way, and in the last 100, 200 years, we have changed everything. So there is a sort of trauma, the body is experiencing, right? And the long-term effects of it comes in form of diseases, right? That's a larger topic to talk about, right? But the thing is, the pace at which we are running, I don't know whether we are creating or we are just breaking things.
I think I would like to answer you this, yeah. Now you're talking about the psychological trauma that, we are undergoing because of this rapid evolution in technology. I would look at the other way. I would like to flip it. Look at the level of confidence level that I have. Now I am a surgeon, and when I did my MCH, I did not know a lot of techniques. I did my MCH in 1993. A lot of things have changed. I'm a neurosurgeon, and you see the evolution that has happened in neurosurgical techniques. Today, I am so confident of going into using a simulator and also getting my students to use a simulator, because the confidence that I'm not jumping from a simulator or an XR into a patient directly without appropriate training. But where I needed training on 50 patients, I probably need, that delta has come down to 5. Okay, so what we need to understand is that this is actually augmenting the level of training, the confidence that I have in training my students, and the confidence that I have that the patients will have a better outcome. And this, I don't think that technology is always going to assist us, and I mean, the changes that we make is because we have so much redundancy in our frontal lobes. We need to catch up with what nature has prepared us for.
Since you are a psychologist, I want to have a question to you. No, that's okay. That's okay. So the ultimate question which you are posing it like, does school kills the creativity, right? So that's what the basic underneath question which you are asking, right? Do you think so? Then it's a psychological question, which as a psychologist can answer like, no. So what I'm trying to say is, when you are educating something, when you are facilitating or encouraging or enhancing the skill set of a person, does a person lose his or her creativity or intellect? That's what your basic question is, right? I think there is no simple answer for yes or no, right? Time will tell.
So we can continue this discussion at our dinner. We just have a last session right now. So we'll close that and we can all discuss at the dinner, so it will be helpful. So we can do it during dinner time, sir. Sure. Do you have anything to say? Close it. Thank you.
I'm sure like we are all buzzing with a lot of questions, so dinner would be like a really good way to converse and to strengthen these connections. Thank you, Mr. Pramod, for that exciting demonstration. As we embrace these cutting edge technologies, it's also crucial to understand the policies that support their adoption and growth, and this point has been raised again and again during our entire event today. So now we have the AVGC XR Policy 3.0, which is a significant step forward in unlocking that benefits that we're talking about for startups and for companies to drive that innovation and the economic growth in our health sector. So to provide us with this deeper understanding of this particular policy, we have Mr. R.K. Chand, the Secretary of ABAI Center of Excellence, India's leading industry body for AVGC XR. He is also the Executive Director of the MIL Technicolor Group, and he has over 22 years of experience in senior leadership positions across global animation and VFX studios. He focuses on growth strategies driven by creative solutions. He focuses on animation, VFX for film, TV, ads, and emerging technologies such as XR, AI, and everything else that we've spoken about. His insights will help us navigate these consequences and the complexities of the policy, and we can understand its implications in more depth. I invite you on the stage, sir.
Robot, and her skill set is really enhanced, honestly speaking, through that. Thank you so much. Thank you. I'll collect. Make it a little easier, I think. Keep the hands free. Thank you, Prateek, for having me. Thanks, Ajay and team, for introducing me to this community and really august presence of all the speakers before me. And thank you, sir. It's a pleasure to come here. Last I was here was for the Elevate jury, and it was really, really interesting. So we are all supported by the KTech ecosystem, I would say, in different center of excellences that way. And I come from an industry which is at the I would say the crux of little bit of media and entertainment, but more of immersive engagement. And this is like in the center, we are in Whitefield. This is our center of excellence, which is focused more on the media entertainment side of this industry. But the policy that I'm going to talk about, which we drafted along with the GOK and the Karnataka ITBT department, is meant for all of us, because we use the same tool set to create techniques which is real-time engine, what benefit it provides for people at different stages of startups, different ways to get market access, different ways that you can use this. So I'll just briefly go through what ABI is. We are an industry body which supports startups to large companies, brings people together in different ways, whether it's in the form of events, whether it's the form of seminars, incubation, like how the NASSCOM COE is. We have incubation systems, which is more, I would say, film-based, but we do have a few XR-based startups as well, and would like to encourage you to come and explore how you can partner with people who have more high visual fidelity skill sets and gain the knowledge of medical representation that you have into what we can create there. Incubation center, we do have something which I remember using when XR was called VRML around 20 years back, I would say. And so what we built over there, thanks to the support from and this is the only facility in India, is a full body scan and a mocap stage where we can use it for obviously entertainment. You have had all the A-listed actors from Mohanlal to Mammootty to Varun to all there. We have a movie out recently which did 500 crores, 3-2, which was also kind of they used this facility. But besides this facility being used for that, this is inspired from the light stage at USC California, where my good friend Paul DeVey created HDRI imagery, which defined and derived how we take light and identify objects and create 3D or CG. So the light stage based technology created this scanning facility, and it has been used in other places by the medical fraternity and by the simulation fraternity to create better digital humans. More empathy is created and generated when you have a more believable patient, a believable character and a visual, as compared to just something that you see and you know that it is a simulation itself. It just in the subconscious drives more realism in there. Again, these are all stuff related to this. I wanted to also let you guys know that with the support from the government of Karnataka, we also run a big conference called GAFX, and the next edition is going to be next year in February 27th to 1st of March. This is supported throughout by the government of Karnataka and the ITBT department. We have sessions where we have, and would like to encourage sessions more on the topic that I saw today, which is at the verge of like an inclusiveness of what entertainment can be and what simulation can be. We had tourism XR companies, we had medical XR companies, we had companies who are using XR technology for helping autistic kids by creating more immersive environment for learning. So how do we use the same tech through which, like for example, the company that I lead in India as an MNC, the Mill, we create simulations and we create emulations in rooms for example, we have built the wine museum in Bordeaux, and the wine museum in Beijing has experience center of the history of wine and how do you experience it. The environment museum, we have built emulators to read your thoughts of a data through a device for promoting the London Art Pass in the Art Fund 6 months back. And we're talking to Science Gallery and other proponents of such tech in India to use it. So how same technology can be used in a different way for helping the medical fraternity as well. So I think it's a good way. Have a look out, check out the event. Please reach out to us. I'll share the email IDs as well. Would love to have the audience know more about what you do beyond the science, beyond the tech behind it, and maybe there can be some network of people who do visual fidelity and be helpful to you. Okay, now the main key points. I don't represent the government. I wanted to be a disclaimer and clarify for that, but I do represent a friend and a person who has been helped by the GOK and the kids the same way that this Center of Excellence has been for many years. So the animation, visual effects, gaming and XR, I would say the extended XR was added to it. This was the first state in Karnataka which launched this policy. This is the version 3.0 from 24 to 29, and this basically covers 4 different areas. And the key goal of this is for us to be able to grow the ecosystem from what we are currently to help transform digitally what you are doing, to help in the sustainability and inclusion by creating awareness among the youth, and exports if someone is in the services industry. But the key goal is for driving IP and to help nurture both by networking, mentorship and funds the ecosystem which is creating products in facility which uses this tech of real-time technology, animation, visual effects, gaming, or even comics. I've seen a good friend who has a comic book on the menstrual cycle. It's a very, very nice comic book, very popular in the West, and it has helped me as a father with my daughter quite a bit as she was growing up, and now she's grown up. But storytelling as a medium was used by the medical fraternity for that. So this policy kind of has 4 strategic pillars. First is the skill development for a future ready workforce, creation of a sustainable infrastructure like the Center of Excellence and an AVGC XR Park that is being discussed now with the support of the chairman of Kionix, Mr. Bachegoda sir, as well. Third is the empowering startups and MSMEs by having a support desk. I'll talk about it a bit in the end, and establishment of incubators and accelerators not only here but beyond Bangalore. Like yesterday and today was the Beyond Bangalore event in Hubli, so we had a presentation of this policy there. Next we are going to go to Mangalore, Mysore, Dharwad and other places as well. And fourth is the Global Innovation Alliance. GI is an important topic for GOK, and then we're trying to have support of various other AVGC fraternities across country to partner with the ecosystem that we have here. And last is the support for funding, and I'll explain about the funding. Some of you know about the Elevate Fund. Elevate supports many of the idea to POC companies. And then there is Kitwen Fund 4, which is dedicated to this tech, this industry of AVG, animation, VFX, gaming. So Kitwen 4 is still open, it's not closed yet, and I'll share more details around it. Okay, so quickly we'll run through because I know that I can feel my tummy rumble as well besides all of you. So, and this document is available online. You can read through the policy, operational guidelines, how to apply. Numbers, quick numbers, there are 4 or 5 different things. There are incentives, there are market access schemes for you to go and market, there are funds available for helping in infra, there is funds available to register your patent, and there is funds available to help you in your QC, because QC is a big part, especially in this sector, you know, in that area. Everything, all these slides, there are 5 or 6 slides. One is related to incentives, second is what's the eligibility, and third is what are the requirements. All of these are documented, and a new portal for a single window for application is being created as we speak with the KTEC or the KIDS department for you to talk to them. I think relevant to this industry, first is the early stage startup program where you have reimbursement up to 40% of your marketing cost, and it's capped at 1 lakh rupees. You have leasing reimbursement, you have operational cost reimbursement, reimbursement help, and compliance cost reimbursement help. As an early stage startup, the startup policy is 10 years. The early stage startup is 2 years within this policy. If you are between 0 to 2 as a policy and have started to gain traction, you fall in this category. The next is the infrastructure support. So up to 20% cap to 20 lakhs, 5 sanctions per company through the policy period between 24 to 29. Rental benefits also up to 20%, capped again at 5 lakhs, 2 sanctions per company. This is an important one. In creative field, it's IP protection and creation, where people write scripts and people also make technology that needs to be protected as an IP. There is an ambition for Karnataka to be the IP hub in this sector for creation, and hence there is support available for companies with the reimbursement up to 50% of the international intellectual property and domestic intellectual property up to 50%. So 5 lakhs capped there and 20 lakhs capped here. Patent and IP, as we all know, is a very expensive process, both filing and legal as well. So this is predominantly to support that. I'll skip these because this is more related to the animation companies, but any startups who is doing, for example, medical animation and doing that, then you can look at this as well. Production grants. So the grant is mainly clubbed together with AR, VR and VFX. This is extended to XR. So folks who are doing more immersive take using cave technology as well fall under this category. This is a reimbursement up to 20% of the qualified expenditure that you have. The QP is defined in the operational guidelines, and I'll be sharing the links to this later. And there will be 3 sanctions per company capped at 50 lakhs. Game dev, there are some people who are developing games to support and help tools that this industry is creating, like rehab, like physiotherapy, like what we saw, I think, during the product launch recently. So you can look at game dev, even if the context is for learning in game dev, even if the game development is to gamify sales. I have seen applications where there is gamifications of medical sales. The jury can review and it can be explored as part of this. Capped at 5 lakhs, reimbursement up to 20% of the qualified expenditure during the policy period. This does not count. QA, important aspect as well. There are certain processes. There is an audit needed at almost each of these offerings, but a quality assurance reimbursement up to 30% of the cost, capped at 5 lakhs, with 3 sanctions per company during the policy period is also available. International market access is a big one, because many times we have to go and travel outside to industrial expos, to medical expos, to simulation expos, and usually as a startup founder, it's the least in your priority. You want to focus on the technology rather than the marketing. So there are funds available capped at 5 lakhs and up to 40% of the cost incurred in participating in international trade shows or expos. GDC is a good example. GDC and Medical XR has a medical simulations. Part of GDC is a separate new section that has started around 3 or 4 years back. This obviously is primarily to attend so this one is key, that the cost incurred towards setting up booth spaces, airfare and visa is only eligible, not hotel and stay, because that is something which is on actual. So just wanted to highlight that. These are the 3 QR codes for the 3 parts of the policy. If anyone wants to take it, else I'll have it sent across and have it here as well for anyone who wants to use it. So first is the policy for you to go through. Second is the difficult part, which is the operating guidelines for that policy, as we all know. Policy is always like the window shopping window, right? And then when you go in, you look at the price tag. And the last piece is the incentive application.
you need to be registered within Karnataka in order to avail it. So to promote employment, in order to promote innovation within Karnataka. But there are certain rules and ways how external companies are now getting attracted to India and how they're able to work with partners here as well for this. But that is all listed out in there. I don't want to take too much time. The incentive application, there are 2 stages. You have to register within KAVGC with kids, and then you have to apply for the incentive in there, so that you can then have your specific product or specific project to be part of the list to qualify. Besides this, there are other some initiatives that we are working along with kids department that I am open to talk to you guys during dinner. And if you have Kidwin Fund 4, again, as I have mentioned, is an important one that we can discuss more later, but it's undergoing an innovation and a change for this sector, and how it's a corpus of 20 crores. And Elevate is idea to PSC. Kitwen has an equity element added to it, but we're trying to reach out and grow the fund more as an industry. So I'll be available to discuss more around the same as well. These are the 2 key email IDs. I would suggest that please have it noted down, and I will also have this sent out maybe through some way to the database of folks who attended here. The GM for kids is the key email ID because he is the nodal authority and the spoke for answering all the questions and related to doubts or any QP related information that is needed. Thank you so much. Thank you.
We sincerely thank you, sir, for delivering such a comprehensive session. Your knowledge and your passion for this field is truly motivating. Just 5 more minutes and then we can wrap this up. Yeah. I'm sure that we've all taken away much from these sessions, and we need to thank our esteemed guests as well for taking away their precious time and spending, their knowledge, imparting their knowledge on us. We'd like to express our gratitude to them about the same. So please join me in recognizing their efforts with a round of applause as we felicitate our esteemed guests. I'd like to invite Mr. Pramod to present Ms. Honey with a memento. Now I'd like to invite Dr. Ravi Shankar Swami to felicitate Mr. Navratan Kataria. Now I'd like to welcome Mr. Deepak to present the memento to Dr. Vikas. I'd like to request Ms. Bhuvana to honor Mr. Hari Srinivasan with the memento. Lastly, I'd like to welcome Mr. Prateek to felicitate Mr. R.K. Chand. I'd like to extend a special invitation to all of you to attend the Path to Parenthood event. The details are mentioned here and on many standees outside as well. It's happening on the October 19th and 20th. It's an initiative by BrandFirst as well as Wiley. It's India's first community for holistic care and support for the different paths that are available to parenthood. So I'd like to invite all of you to that event as well. Finally, as we conclude today's event, I'd like to extend a welcome to Dr. Ravi Shankar Swami to deliver the vote of thanks.
Apologies, I'll just say thank you very much for coming. Okay, that is the simplest way to tell, because there are a big list of people who need to thank. But I'm really grateful for my team. That is the biggest thanks I would say. Yeah, because they have put a fantastic work from the last few days, all the WhatsApp groups, everything. So really thank you very much for that. All the speakers, thank you very much for coming here. It was a fantastic thing to learn. And of course, people who are braved the rain and staying back, let's have a good dinner. Okay? Thank you very much for us.